The definition of dissociative identity disorder, also known as DID, is a multiple personality disorder described by an individual switching to alternate identities. A person may feel the presence of two or more people talking or living inside their head. Each identity may have a unique name, personal history, and characteristics including obvious differences in voice, gender, mannerisms, and even physical qualities, such as the need for glasses. A person may even experience memory loss. The background of DID is that Dr. Jean-Martin Charcot, chief physician who specialized in neurology at a hospital in France, discovered the new disease. In the late 1880s, he called it hysteroepilepsy. The disorder was thought to combine some traits of the two already discovered mental disorders, hysteria and epilepsy. The causes of DID are trauma, depression, and anxiety. The disorders most often attribute to children and to long-term physical, sexual, or emotional abuse.
Statistics show that the rate of being diagnosed with DID is relative to 0.01% to 1% of the general population. As you can see, it is very uncommon. As a result, there are little treatment options, however effective. For example, family therapy and creative therapy. One is participating in counseling that involves family discussions. This results in resolving conflicts and communication error. On the other hand, creative therapy refers to more expressive and creative in nature, allowing clients to explore their negative feelings concerning their other personalities through art and writing. There are great ways to both self-improve and experience personal growth, but despite these benefits, it can be overwhelming. It can unable to remain the same person or to ask for help. To them, it's frightening to admit they're mentally ill.
Now, let's move on to the treatments there are for dissociative identity disorder and what they're like. It's important to note that most treatments for DID aim to be therapeutic with helping the sufferer because, as you know, the sufferer has some sort of trauma that caused them to develop the cognitive disability. And the main goal of the treatments are to ultimately have all the personalities work together or have it unify back into one personality. Examples of these therapies include psychotherapy, which is a basic one-on-one talk with a therapist or psychologist, or cognitive behavioral therapy, which aims to promote positivity in the individual's thinking as well as their behaviors. Other therapy treatments also include dialectic behavior therapy, family therapy, and creative therapies and there are medications that can be taken for those with DID, but those are mainly to address other psychological disorders that they may also have.